Good evening, Mabuhay and Namaste. Welcome back to part 2 of Healthy Heart. We are in conversation with Dr. Anuj Clerk. I hope most of you got your answers on heart attack and heart failure. In this segment, we will find out more about cardiac arrest and prevention. So stay with us for the next 1 hour to know more. Ivy brings to you Wellness Wednesday with critical care specialist Dr. Anuj Clerk.
Now we are moving on to cardiac arrest. So in a case of cardiac arrest, what can be done at home? How do we know that this person is undergoing a cardiac arrest?
It is as simple as, if I ask you a simple question, is there electric supply in the room that you are sitting? The answer is yes. You say that lights are on, my computer is on. It is a proof of electric supply. The same way, human brain should be looked upon as a supercomputer. It does not work without blood supply. The very fact your bulb will not work for a second without electric supply, the brain will not work for a single second without blood supply. Let's understand one fact. The moment person is unconscious, how do you differentiate between unconsciousness and cardiac arrest? This is something very essential for lay people to understand, that if a person is breathing normally, making any limb movements, any movement from the body, is not in cardiac arrest. Because brain cannot move, or brain stop functioning the moment heart stops immediately. That doesn't mean brain is dead. That doesn't mean brain is damaged. That means the differentiating point is the person is fall unconscious. When you tap on the shoulder, observe that person from head to toe for 10 seconds. If it doesn't make any movement, any physical activity, look at his chest. No need to remove the clothes. Just look at the chest. Is this chest moving from respiration? Respiratory movements, everybody is aware that chest keep on expanding every time we breathe. If that movement has stopped, that means this person is cardiac arrest. Don't waste time in checking pulse. Non-medical personnel, unless you are well-versed with it, doctors and nurses, medical and paramedical professionals should check pulse to diagnose cardiac arrest. Non-medical person should look at only two things. Person is not responding to your tap, not moving anything to your request, not making any chest wall movement in breathing, you diagnose that is cardiac arrest. Then the question about what do you do? That we always teach in basic life support. Step 1, safety. Your own safety, patient safety. If you are in public, introduce yourself to the crowd. What are you intending to do? Otherwise, a male putting a hand on the female's chest in public can be misunderstood. So be careful. I would request my all male colleagues that please introduce yourself. I am yet to see a thief who is announcing in public his name and then do the theft. No. So introduce yourself to the public. What you clearly clarify your intent in one word, that I am Mr. So-and-so. This life is in danger. Please help me to help. Third, note the time of the event, which is the most important mistake people do, because that is what information we need as a doctor. When this event happened, because there is something called an unwritten rule. If the heart is stop functioning, after 3 to 4 minutes, the organ system starts deteriorating. At the end of 6 to 8 minutes, the brain damage becomes permanent. 6 to 8 minutes, brain damage becomes permanent. So you need to act fast. So you have no time to wait for your colleague, no time to wait for ambulance, no time to wait for doctor, nurse to come at home. You have to act there and then. So contrary to my first advice, in heart attack, rush to hospital. Here in cardiac arrest, you have to start doing chest compression. What you should do in today's era, you call your doctor on phone. Request him to call you back or on a video call. On video call, your doctor can see and he'll ask you the same thing. Tap on the shoulder, look at patient is not breathing, not responding. put your hand, this part. This is called heel of the hand. Part of the palm opposite to your thumb. This is heel of the hand. This heel of the hand you should put in the center of the chest. In fact, I have just sent across a video. If you can just play a video, that will that's a 2-minute, 2.5-minute video, which will tell you all the steps. So would you mind playing it? Do we have it?
Yes, we do. But we can't hear the volume.
Collapsing. The moment. Hello friends, I'm Dr. Anuj Clerk. Today I am going to demonstrate basic life support steps. I have seen a victim collapsing. The moment I saw a person collapsing, that is the time called arrest time. So please note that time and move on. Then we start with step number 1. Step 1 is scene safety. I am safe, victim safe. Only if the scene is unsafe, then only shift the victim to another place. Otherwise, kneel down next to the victim and go to the step number 2. Tap on the shoulder of both the sides and then see the victim from top to bottom. Again tap. Bhaiya, kya hua? See the victim from top to bottom. For 5 to 10 seconds, if victim is moving and victim is breathing, then put the patient victim in recovery position. If they are not, then after 10 seconds, call for help. Person in black t-shirt, please call the ambulance and call AED. I call for the ambulance and AED. Thereafter, if you are doctor or nurse, you check the kinetic pulse. If you are not doctor or nurse, not medical professional, should not check the pulse. They should just observe if the patient is breathing or moving. If they are not doing any of it, straight away start chest compression. For chest compression, you have to put your heel of the hand in mid of a sternum, lower half of the sternum. Put the second hand over it, knee of the knee in front. Your shoulder should be in the patient's midline, elbow should be locked this way, and then your fingers should be off. Only heel should touch the lower half of the chest or sternum in the center. Then compress 5 to 6 centimeters. Give 30 compressions at the speed of 100 to 120 per minute. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11, 17, 14, 15, 16, 17, 18, 19, 20, 21, 22, 20, 24, 25, 26, 27, 28, 29, 30. After 30 compressions, if you have your pocket mask, you can use it. If you don't have it, give out to more breath. Pocket mask, you place it on the face like this. Then hold it to neck extension, head tilt, and chin lift. Then have your eyes on the shoulder. Give 2 breaths. And then again give 30 compressions like 1 and 2 and 3 and 4 and 5.
So when you, after 30 compressions and 2 breaths, you say step 1, safety. Step 2, check the response. The person responds, you put in recovery position. If in step 3, call for help, dial the ambulance. That means you request somebody else to go, and if you are alone, then pick up phone, take your doctor on. Doctor can guide you what to do if you are not trained in doing CPR. So a video call, let your relatives stand in front with a video call on, and on video your doctor can guide. And this is absolutely legal, recommended in international guideline. It is not what Anuj Clerk is saying. It is there in every international guideline, and I am teaching this on the capacity of an official American Heart Association accredited teacher. So we conduct this thing. We have already more than 280 such workshops under our belt, covering almost 11,000 people. So we do teach this, that take your doctor on a video call. They will guide you where to compress it, but compression is going to save life. So what if the rib breaks? What if person blamed that you are doing wrong things. No, stick to this is absolutely legal as long as two fundamental rules. Your own safety should not be jeopardized. Whenever you are in doubt, when the patient is breathing, not breathing, you are in doubt, do chest compression. Nobody is going to die because of your chest compression as long as it is done in the perfect position and the way it is shown here. So it is safe. Even if the person say you made a wrong diagnosis that his heart is not stopped, then even it's not going to kill them. Even if the rib fractures, that is going to heal. But if a person's life is lost, there is no question about what injuries on the chest. So please be proactive, but diagnose it correctly. No lack of response, not breathing. Call for help. Start chest compression. Give 30 compressions, then give 2 breaths. If you're not comfortable in giving mouth to mouth breath, then you can use a pocket mask. You can keep a pocket mask at home or in first aid box of the building, or you can keep such thing in your glove box of your car or dicky of your two-wheeler. Absolutely recommended. Use this type of pocket mask that can facilitate mouth to mouth. Say for example, you have nothing of it. You continue only chest compression till the ambulance people arrive or you reach to hospital. We have seen people waking up by the time they reach to hospital. And that's what you have saved life. You cannot give somebody more than this ever in your life. This is a gift of life. That means doing chest compression on time, the way it is recommended, is absolutely essential. Don't worry, every country has their laws. That what is the difference between assault and accident? It is the intent. What is your intent? To save life. What you are doing as per the international guideline, then no court of law is going to blame you for causing injuries, which if at all it happens by legitimate prescribed method of chest compression. Even if your diagnosis is wrong, that patient is not in cardiac arrest, I am yet to see a person being blamed and taken to court of law in my 30-year career. So if you find such a case, please draw attention to to us who teaches BLS now and then. Please don't worry about it. Please do it, then think. If you are in doubt, always do it and think. We have seen large number of people who saved their family members' life, especially why you should learn it. Number one, if you especially those people, say at petrol pump, you will find fire extinguisher. Why? They are more likely to have fire than average places. So if your home, your family member has heart attack or stroke or diabetes and obesity, they are more likely to have a cardiac arrest at home. So that means you should prepare yourself by having education, such leaflets, so that if God forbid if that happens, then you are prepared. If you are not prepared, still take help of a video call from your doctor or an emergency department. Nowadays, established emergency medical system, say for example in India, in USA, they have 911, right? So 911 can guide you on phone that what to do. They will actually tell you, okay, do this, put a hand like this. Nowadays, there is something called AED drones. So this technology has evolved to the extent that AED drone, when it reaches to you, it connects you through video call to a nearby hospital emergency department, and they will guide you as if they are sitting next to you. Then why you're worried? Please work on establishing such network in the era of this digital advances. Take best advantage of it. So that, but here time is life. Every second counts.
I think we must now make a good friend who is a cardiologist, right?
Need not to be a cardiologist. I'll tell you very clearly here. Now in today's advances, it is not only prerogative of cardiologists. In fact, intensive care professional, emergency department professional, pre-hospital care professionals, even paramedical professionals who are trained in it, any one of them can be of best help, provided they are available on time. Bottom line is they should pick up your phone and then answer in the hours of crisis. But if you keep on calling, as a doctor, I'm telling you, if you keep on calling a doctor for headaches and stomach aches, he will not pick up the phone at these hours. So you be very choosy who you are calling from. And we are in the discussion with certain institution to establish such call centers where a person is sitting just to do this. So as far as telephone calls are concerned, the distance doesn't matter. And that's what the recent advances in telemedicine. So these are the things we should expect telemedicine should bring to us. That gives you a sort of security that in case of crisis, I'm going to call up this number. The doctor is sitting there on the call center, is going to answer this question. And it is legal within the legal framework of the country.
Right. So it is so important to have these important numbers on your speed dial, friends. Make a note of this. Talk about this to your family and friends. Put a note on the refrigerator. I think what is most important over here is taking the right decision at the right time. Time is very precious and crucial, especially in this case. So, Dr. Anuj, so any medical personnel, anyone can do CPR, or it has to be a medical personnel, or can somebody learn how to do this? How do we go about this? How does one learn these methods?
Say, I always keep on giving example of making roti. If you see a YouTube video, how confident you will become to you will become confident until you make one. Correct.
Yeah,
so
exactly.
in you cannot do chest compression of a live human being. Then what is the option? You have this type of rubber mannequins available. So you have to enroll on a course where this type of didactic discussion happens. Spend 1 day in lifetime. I request 1 day in lifetime to get aware of that, how it feels, how to take steps in emergency. I have had my doctor friend who are colleagues. They are living in a very small village, distant places, who have saved their spouse because they have learned. So I always keep on passing a joke to my all doctor colleagues that, have you taught this to your wife? You might be a philosopher and guide, you might have written thousands of chapters and hundreds of publications, but if you don't teach your wife how to do BLS, then you are the biggest fool. So please make sure that you attend such courses. You have to attend to, there is no shortcut to success. Just by looking at the video, you will never learn how to make roti. You may be aware about that. You may say, okay, yes, something like this can be done. But when it's time to do it, you will not find enough courage to compress a human being's chest. But for that, you need a skill station. That means I can teach from here the theoretical aspect of it, but you need a mannequin. That is possible, that you gather at a place, say for example in Philippines now, I can give you a didactic lecture on video, one side here and one side there. I can actually tell you that, okay, compress this much, do this much. And that's the way a teaching session is possible. And that widespread, say, I would say the COVID era has made these Zoom meetings, practically everybody has started doing is who has access to internet and laptops. So that means the knowledge can come to your doorstep. You don't need to even go there. The bottleneck is the availability of that mannequin, rubber mannequin. So you can practice it on a doll as well, but they are not long lasting. But as long as you are a single center, so inflatable mannequins are available. Many manufacturers makes it. So when it's just like an inflatable pillow. You can buy it in India. It is from available certain companies, that inflatable mannequins for teaching in family. So you can buy one for a whole building or apartment, and then keep on rotating and then learn it. You can celebrate 1 day in a year on all your festivals, where there will be one corner, just like you have a different corners providing food items. You have one corner where this continuous training is going on. So everybody is aware that in case of emergency, please do it. It is the question of not only knowing about, but knowing is very important first step. Because if somebody is doing it in public, at least you will not blame that for harassing a female in public. So awareness starts from there. Second, you may not have enough courage to do it, But when somebody else is doing it, you will find enough courage to do it together. And the last thing is, if you are done once in your lifetime, you will do it alone and save somebody's life, and that will be the best day of your life. So you can't do more than that, the gift of life. So basic life support training, I would say that if I am allowed to dream, I would not pass anybody 12th standard without learning basic life support. It should be as strict as this. If and I am trying to endeavor, we have adopted physiotherapy colleges, nursing colleges, dental colleges, and we guarantee them that if you cooperate, we will ensure that no student will appear in university exam of a medical graduation or paramedical graduation without passing a BLS certificate. So let's do that, because I would say that you can do it in schools, higher secondary schools. Let's start with teachers. If I would say the biggest way to change the society is to teach the teachers. So whenever last week I have taught it to a group of teachers in one of the school, they were so enlightened that we knew it theoretically because they are learned people, teachers, but having courage to do it in public, nobody will do it unless you have passed through a skill station. So it has to be learned by skill stations.
I actually really like something you had said initially, was that the intent should be there. And I think if that intent is there, the rest will follow. And actually, Ivy recently completed training 100 first aid responders for mental health. Maybe this interview can lead to take up a CPR certification or a BLS, which is a basic life support certification as well. So, viewers, please give me a thumbs up if you want to learn more on CPR. We will soon come up with a learning session. All right. So we are going into the next the next part, which is heart failure. And the question that has come in for heart failure is, what are the signs and symptoms of a heart failure, and how does one manage it at home?
Say, as I already narrated, that heart failure is inability of the heart as a pump to deliver what it should. Means X amount of blood, say around 4 to 5 liters of blood should be coming out in average built individual. Say around person is 50-60 kilo, his heart should be able to get pump ideally around 5 liters of blood, right? 5 to 8 liters is the normal range, as we say. If that amount of blood doesn't come out because of multiple reasons, heart failure can be its inability to pump enough blood per minute. If this is less than what the human tissues require, we call it heart failure. Sometimes heart may be able to pump it, but exerting more. That means it starts building up pressure in the lung. So what are the symptoms of heart failure? Easy fatigue.
Right.
Activity level can be as small as brushing teeth, changing clothes. If you start feeling breathless or out of breath, that can be signs of heart failure. And as the heart failure advances, say initially breathlessness while climbing stairs, breathlessness while moving around, it starts from there. The bottom line is short of breath. Then the worst case, in the last stage, what will happen? It will not let you lie down flat on bed. If you tend to sit at night because of you are out of breath, consider that this is heart failure. This is what we call it orthopnea. Unable to lie down flat, you feel smothered, you feel out of breath, you feel it is very hard to breathe in lying down position, then you call it, this is possibly heart failure. So see a doctor the moment you are out of breath during your exertional activities. Climbing stair is one. When it is more severe, lesser amount of exertion also precipitate this type of symptoms. So what do we do once? First of all, heart failure cannot be treated at home. Number one. You cannot pop up a pill and treat heart failure because it is a manifestation of a big underlying heart disorder. What are they? It can be a valvular disease, it can be a heart attack which has damaged more than 40% of the heart muscle, or it can be a swelling on the heart. It may be a disease in the lung affecting the heart, or sometimes it may be as simple as diarrhea and vomiting, which puts extra load on the heart, which is already stretched because of the underlying disease. And now it says, give up. Sorry, I cannot compensate more than this. So that means I have gone to hospital with a diarrhea and now my doctor is saying you are in heart failure. These people are there. No, please understand us. Please understand the science behind it. Heart and lungs are one set of organs. We are interconnected. It is just like I would equate it to husband and wife in a couple. When one is stressed, next person automatically gets the stress. The same way, if a heart takes the load of providing blood supply to whole body. If you have fracture, it will require more blood to heal. So a fracture will put more stress to heart. If person has diarrhea, that leads to dehydration. So less amount of blood in the circuit. It will increase the heart rate. Why? Even if you are in stress, your heart rate increases. Why? Because the load ultimately comes to your heart. So even mental stress also can precipitate heart failure. Anything. So bottom line, there is a heart disease which compromises its ability to compensate for these diseases. So that means I would use the word, if I won't be wrong if I'm using the word, that diarrhea led to stress test where the heart failed. Chest pain led to stress test where the heart failed. Your emotional burden led to stress test which heart failed. So when the heart fails, you need to balance it out again. You reduce the load on the heart, you support the heart to come to terms. So you have to go to hospital. Heart failure means inability to lie down, going out of breath, breathlessness at a smallest exertion, or another thing is coughing that comes out on exertion, especially coughing that starts at night, coughing which is more at night than daytime, coughing which you gets up, you are lying down after 1 or 2 hours of sleep, you gets up at night, suddenly you're feeling out of breath, you start coughing violently. There can be other causes also, but first thing we evaluate when you're in the hospital, whether in heart failure. Then the second question is, what do we do to diagnose it? Echocardiography, ECG are the first things that we do. So echocardiography, ECG are the two important besides. So when we examine with stethoscope, we find out murmurs because of abnormal heart sounds. It's heard like gallop, like this, gallop of heart. Instead of two tuck 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 tuck, it tuck 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 tuck. This type of heart sounds are the first thing we auscultate with stethoscope. Then we find murmurs. Then we find crepitations in the chest. That's the way we suspect clinically that you may be in heart failure. Then putting echocardiography, doing X-ray, ECG, that we document that these are the abnormalities. Then patient, by and large, heart failure patients are treated in intensive care. And we have seen many patients who are not brought to hospital on time. Thanks to COVID, yes, I'm using the word, pulse oximeter are found in every home now. So use that pulse oximeter at that time. So if person you're out of breath, especially say mom has gone to toilet, after coming back they are out of breath, check the pulse oximeter. If the heart rate is high and saturation is less than 90% on exertion, drop in saturation by 3 to 5 points after exertion, blame it to heart failure until proved otherwise. This is a very simplest thing. Post exertion, it is very 6-minute, 3-minute walk test are made very popular. Who with COVID pneumonia should go to hospital? It's not only COVID pneumonia, it is just COVID pneumonia has brought this topic to your doorstep. The fact remains the same that you use the pulse oximeter to diagnose heart and the lung condition early, and which lowers your threshold. If the saturation drops down by 3 to 5% at home, please rush to hospital. Again, the same principles are like heart attack. Do not do exertion, reach to hospital in time, and we will start what is required. We will give medications like, again, sorbitrate can help in heart failure. Okay, sorbitrate can help in heart failure provided blood pressure is okay. If blood pressure is low, some people keep on popping the diuretic pills that if I pass a lot of urine, it is partly true, but don't do it unsupervised at home by yourself. It can harm. If a small drop in blood pressure with heart failure will increase the chance of death by multiple times. So don't do all this jugglery, because after some time when a patient with heart disease, they have all this medication so long. So they have certain ideations. Say, if I take this medicine, I feel better. So they keep on popping up one after one and after another. So this type of self-medication must be discouraged. So if you are these things, come to hospital, we will examine, we'll do the echocardiogram. Within minutes, it can be diagnosed. Most important, patients who are out of breath with low saturation, we have something called BiPAP mask. In hospitals, emergency department, when we put the BiPAP mask, within seconds, I repeat the word, within seconds, person will start feeling better. But what BiPAP can do, no other medication in the world has ever done it. So that you have to go to a hospital with heart failure where this type of facilities are available. So nitroglycerin infusion, diuretic injections, and BiPAP within minutes can change the position from extreme worse to stabilizing. And we have seen that patients are brought to hospital at 1 o'clock at night. By 6 o'clock in the morning, they are sitting in their bed in ICU and drinking tea. The improvement can be as fast as this. But if the same person is brought to hospital at 3 o'clock, by 6 o'clock, he may be dead. So it is a question of few minutes to an hour. Heart failure puts a lot of stress on heart. And then if you don't attend it, so I would say be kind to your heart. That's the word I would use it.
Right. So friends, one thing that I have learned is that the heart and lungs are married to each other. They are husband and wife. And the most important part is, and thanks to COVID, I think all of us have a pulse oximeter at home. At any time you fall short of breath or the person around you is falling short of breath, do check the oxygen. And if it has dropped down, that is your indication to rush the person to the hospital. Again, time is important. We do have Kavita asking us that how do we know that somebody is prone to heart diseases and what investigations or tests should be done for this?
Very good question. Say, first of all, there are risk factors. If person is hypertensive, diabetic, has high cholesterol, and whose lifestyle involves less than 150 minutes of active exercise in a week, these are the people who are obesity, hypertension, diabetes, hypercholesterolemia. These are diseases. But smoking, alcohol, this thing will put a person at a higher risk of developing heart diseases. So these are the people who should get their heart checked at regular intervals. So that means I would refrain from taking health packages, because it's like in package, it suits the hospital rather than the patient. So rather than what I would do, listen to my doctor. Go to a doctor, express your concern that I am having all these risk factors. I want my heart checked. So do what matters. That means in your health checkup package, say, I would say that as a medical fraternity, it's like you want to find out one heart disease patient, you will screen hundreds and thousands of patients. Rather than when you look at the clinical pre-test probability, that means patient having these risk factors, you are more likely to find heart diseases. So you screen them, you diagnose them, you do your best possible means. That means sometimes, again, the same railway station effect will come. You are at rest, your heart is at rest, you have tummy full, money in your pocket, job secured, you're mentally relaxed, you get a ECG done, echo done, nothing abnormal. But if you don't stress your heart with a treadmill test, treadmill test will tell you that how is your cardiac endurance. If your endurance is poor, that's the beginning of end. I repeat the words. If your endurance is poor, that's the way it starts. Because before catching fire, the surface becomes warm and hot. The same logics apply here. That if your endurance is poor, your heart is not geared up to tackle the stress. So that means what is exercise? Let's understand one thing. People have a lot of misconceptions about exercise and, oh, I have 10,000 steps in a day, so I have done my bit. No. As far as endurance is concerned, you have to have your target heart rate achieved and maintained for at least 20 minutes. Now, what is that? 220 minus your age. Now, whatever numbers it gets, you achieve around 85% of that as your heart rate. If you achieve that heart rate for close to 20 minutes, then you consider that this is my exercise session from endurance point of view. Again, exercise for muscle building, for flexibilities are all different topics. Let's not mix up. Yeah. So here from heart point of view, you have to acquire and maintain endurance. Then you are less likely to die of heart disease. As simple as that. So you have to engage in a physical activity which increases and maintains the heart rate to your target heart rate level. So first of all, know what is your target heart rate level. As simple as 85% of 220 minus age is your target heart rate. Achieve and maintain at least 5 times a week. If you're not, then you are at risk of heart disease. Irrespective of, so it is the one risk factor is your physical inactivity. If you add obesity to it, if you add hypertension to it, if you add diabetes to it, if you add smoking to it, then you are more near to heart disease. So if you are having heart disease and obesity, then invest your time. I reuse the word, invest your time in exercises. There is no pill in the world can move your hand. No pill in world that can move your legs. So don't expect medicines to do it. People say that, oh, my doctor is very good. He has given me X number of aspirins and statins and my cholesterol is down. Let's be very clear. Every medicine has their own side effect. So don't expect medicines to do it. So this is the way you should screen it. This is the way you should prevent it.
Okay. Thank you so much for that, Dr. Anuj. If this does not motivate you, what else will? Friends, that lifestyle is what is important. Your exercise is important. Eating healthy is important. Dr. Anuj, somebody asked us that are heart diseases hereditary or are they just related to lifestyle?
There is a hereditary component. These components are very complex. So, especially if a family member has heart disease or for that matter, atherosclerotic diseases. So these are a group of diseases. That means stroke is involved. That means paralysis attack, heart failure, peripheral vascular disease like limb gangrene. These all things put together forms a atherosclerotic diseases. If your family member has atherosclerotic disease before the age of 55 in male or 60 in female, any one family member having this, or any family member has a sudden death, that any family member has suddenly had a chest pain at home and died even before taken to hospital, before the age of 55, think that there is an hereditary component in your family. So whenever so we don't talk much about it because discussing this about, you start blaming your ancestors, you start blaming your genes. I would prefer that do what matters. If you're not going to change your father and mother, you're not going to change your genes. Why to bother about it? Yes. But one thing is that if you are from such a family background, then it makes it more important that you should not put on weight to become obese. You should not engage into dangerous activities like smoking and alcohol. You should not, you make exercise as your way of life. You should not do what adds up the risk factors, because your genes are bad. Even after doing everything, you are more likely to have heart attack than your average colleague who are doing exactly the same. So keep on doing health checkup, do diagnose on time, treat on time. That can really reduce the risk of death, then prolong healthy life even with that bad risk factors. So it's like having a risk factor is definitely one component, but use it as in positive sense. That means I have a risk factor, then I should not do excuses in not doing exercise. That means doing exercise, have a healthy lifestyle is the mandatory way because I have bad genes. That's the way you should interpret it. Yes, there is component of hereditary, but we don't end up in talking a lot on public media because it is misunderstood that, oh, I have a bad genes, that's why I developed it. But he will forget that I have not used my body the way manufacturers advises. Manufacturer do advise that use this machine in X and Y way, but we don't listen to it.
Right. So it is so important. You must know your history and do what is right for your future, which is control the controllables, right?
Yes.
Now, we have somebody ask us right now that people generally avoid taking allopathic medicines, especially if it has to be taken every day because of its side effects. Do you have any solution for that? What do you recommend?
In fact, we do keep on discussing about which pathi. In fact, just like religion, we are trying to dissect the science in different pathis. Say the way of thinking can be different between the pathis, the logic remains the same, that you have to have a molecule entering in the body that helps and not harm. As keep it simple. So there is not, I am yet to find a single-sided coin in the world. If you find, give me. So if you have a molecule entering in your body, if it has an effect, it will has side effect.
Okay.
Now, which one is more common and can I afford that side effect for the benefit I am trying to get is that matters. Now, I'll tell you very simple things. Rely on a person who is prescribing you or advising you to take a pill, may it be homeopathy or from that any pathy. Request him to write down on a piece of paper. If he has courage to write down on a black and white with a signature underneath it, he is a correct guy. Number one. A person who is not ready to write down and prescribe, so that means he is not legitimately prescribing it for you. He is just doing it just like a gossip. Oh, you take this pill, you will prepare. The moment you suffer from it, he is not going to. I have had n number of times that person suffer from side effects of X or Y pathies. And when you call up that person who has prescribed it, they deny of advising such things. Be careful of it. So if say that allopathy medication, say allopathy, let's use the word modern medicine. I don't say that modern medicine doesn't have its own problems. This I'll call the biases which are created. And that's why I use the word in medical science. What I teach my student is truth will stand test of time. So a medication which is there for more than 2-3 decades, which has a very good track record, take it. Don't indulge in something which is absolutely new and under experiment. So those medicines who are taken for certain medications who are not having any proof, but people keep on taking for years because of hearsay. There you take this, say for example, garlic and ginger and all these herbs are known for its protective effects. But in what dose? Will it lead to acidity? Will it suit my body? Let a practitioner, you let a certified practitioner prescribe you that dose and manner in which you to take it. Just don't take it just because you think that allopathy will harm me and Ayurvedic or homeopathic will not harm me. So no, you talk to allopathy trained personnel or Ayurvedic trained personnel, a person who is having a legitimate degree, They would be able to tell you which medicine for which purpose at what doses, do not exceed or do this or that, otherwise lead to harm. Have you discussed all these matters? And absence of evidence does not mean there is not. So let's not misunderstand that certain. Do you have a research paper on do you need to drink water when you are thirsty? No, you don't. So let's have a room for common sense. So those, I would say that those who are so greedy that I want a medicine which should not harm and only benefit me, God will save you. You will never find a medication in the world who will not have a side effect. If somebody is telling you he is lie, he is into medical business, and I refrain from such advices that be kind to yourself. Take what is there advised by a registered practitioner. If you are following in Ayurvedic, no issues, perfect. But let it be prescribed by a person who is Ayurvedic medical professional. Go to a professional who has the degree, who has experience in prescribing those medicines, and then take it. Don't take it from a pill box where there is no written name on it, no expiry date, no company's name, no batch number. When you take it herb from over the counter and then expect, in fact, so many medications from X or Y pathies are banned in certain countries because they do not have required papers. But do you need paper for everything? So don't have that belief that Ayurvedic medications or homeopathic medications are harmless. All allopathic medications are harmful because you have to take it daily. Come out of it, that dogma. A molecule that enters the body has to be known. You should know about it. You should have prescribed and then interpret. So don't enter in your self-fulfilling prophecy that allopathy medications are bad. So what is allopathy? Most of the allopathy medications are come from herbs. When a herb having molecule crystallized and we know the molecular structure, they put to practice about the clinical trials, and a lot of hard work, lot of money has gone into crystallizing, stabilizing, standardizing the dose, has become allopathy. At the end of the day, say what is digoxin? Just to give you an example. It's a plant herb. It's a plant extract which granny was used to giving people with pedal edema. And after that, herb pedal edema used to disappear. So people started inventing that, researching on that plant extract, and they could crystallize that it is this molecule, which is now we call it digoxin. It helps in heart failure management. But we know for sure that in kidney failure patient, you can't give it. You have to be very categorically of muscle mass of the patient when you prescribe the dose. So this is what helps. It is an additional wisdom acquired with clinical trials. So let's not divide medical science into pathies, just the way we divide human being into religion. It should make our life better rather than make this thing complicated. Keep it simple. Give me something that helps. Don't give me something that harms. Period.
That was so beautifully put, Dr. Anuj. You have really opened up my mind to all these things, that beliefs that even I have been listening to. And thank you so much for that. Friends, whoever you go to, whichever doctor you go to, see to it that you are going to a proper registered, a person who knows, who has studied his subject and who's registered as a legitimate practitioner. And it doesn't matter whoever you go to, but just see to it that you go to somebody who is registered. Doctor, last but not the least, please guide us to a path of a healthy heart. What are the measures should one take? And in fact, we have Sucheta also asking us that people have lower back and knee problems who cannot do cardio exercises. In such scenarios, what fitness regime would you recommend?
The first important thing is you should start having your day with those basic measurements. If you say that if I'm a health conscious person, what is your today's weight? Keep it simple. What is your height? What is your today's weight? What was the last cholesterol? When was your last HbA1c done? What is your weight into your fat proportions? These things you should know first, and then you start having your daily regime. Even with your upper limb exercises also, enough cardio workout can be done. So you need to find a fitness instructor who will guide you into the regime of cardio exercises. All the exercises does not mean cardio. You can put your muscles to stretch even while sitting in your chair. After doing that weight cuffs also, you can reach to a certain level of endurance. So it is very much essential that you contact a fitness instructor. But starting from basics, reduce your carbohydrates in your diet. Make sure you maintain your ideal body weight. If I say to keep it simple, if I'm 160 centimeter in my height, my weight should not exceed or should be around 60-65 kilo. So if you're 165 centimeter, especially this is very common problem in female, that body mass index of female is the normal range is lower than the male. So your BMI should be around 20-23 and not 26-27. So that means I would say that in female, it is becoming more important. They suddenly take a downturn in their health the moment menopause sets in. So do it before that. So that means train your body, streamline it. I would say just be ready for the old age. That's the better word I would put it. So spend time for at least half an hour to 1 hour. Measure cholesterol at regular intervals. There is a lot of hue and cry and misconception created by the cholesterol theory in between, that the cholesterol is all just say cholesterol per se is not that bad or good. There are certain types of cholesterols. So maintain them in range. You should know the glycemic index of the food that you eat. What's going to raise the sugar very fast? Keep your sugars under check if you have diabetes. Have your health checkups done periodic intervals. Don't keep on taking a jargon. I would refrain from falling into traps of many institutions that instead of 5,000 rupees, you will get the whole things done in 2,000 rupees. But you will get 19 out of 20 tests, which you don't need. Instead of spend something very specifically on the things that you need. So health checkup should be custom made, not just because you have X years of age, you take up this. You should look at your family background, your risk factors, take health checkup so that you can modify your even exercise regime based on that. If your endurance is poor, you look at that. If your muscle mass is poor, you can make your changes in the diet. Consult a dietitian, and then you look at very easy thing I would keep on recommending everybody is maintain a diet diary. See what you're eating. As simple as that. You at night just recall what you have had today, and then we are all smart enough. We know about the carbohydrates, we know about the glycemic index, we know about the junk food, we know about the oil, everything. I think we don't need to discuss it. But how many times we look at our own self? So if you keep it simple, maintain your diet diary. You write down everything that you eat at before going to bed. You will come to know next day morning you will avoid X thing. Then I had a coffee. When another friend came, he offered me, I again had a coffee. Why? You could have avoided that second sip. Right? So say boldly to no. Just because you are meeting, don't keep on gulping up more sugar. Just because you want to celebrate, don't keep on throwing up the party with the junk food. It is a poison that you are spreading amongst your loved one. Instead, Can we have a calorie expenditure parties? Think about it. I think we have time for it.
That is such a wonderful idea, Dr. Anuj. Thank you so very much for that. That brings us to the end of today's questions and answers segment. Today's session has definitely helped in understanding the heart in a medical way, its conditions and how one can manage it. The key points that you can take back today are chest pain, which is aggravated by exertion and relieved by rest, is heart attack. If you suspect a heart attack, then stop all activities immediately. Lie down if you are not breathless. In case of chest pain, don't waste your time. The first aid at home for chest pain is rest, chew 75 mg of aspirin or suck sorbitrate by keeping it under the tongue. If blood pressure is low, do not take sorbitrate. Rush to a well-equipped hospital immediately. Always be prepared for an emergency. Discuss with your family openly. The things that you must keep in handy are ambulance number, your nearby hospital number, a pocket mask for CPR, and a pulse oximeter. In case of breathlessness, use a pulse oximeter to check the oxygen level. If oxygen level is low, rush to the hospital immediately. Get certified in basic life support or BLS to learn CPR. Remember, intention matters. Thank you very much today, Dr. Anuj. It was so lovely having you today, and you have really thrown a lot of light and have explained it so beautifully for a layman. And thank you so much for giving us your time.
Thank you very much.
I truly hope that you have benefited from this session as much as I personally. The next episode coming up is on cervical cancer. We have often heard this term, but do we know what that is? Do mark your calendars and don't forget to tune in on the 8th of June for the third episode of Ivy's Wellness Wednesday. Watch the space for more details, and you can send in your questions on the topic right here on this page. Do keep asking your questions and we will get the answers for you. Until then, take care of that little heart, stay healthy, stay safe, and stay well. Because a better I is a better we. This is me, Vaish, your host for Wellness Wednesday, signing off. Good night and namaste.